And our last presenter for this session is Jaycie Ponce.
All right. Hello, everybody. My name is Jaycie Ponce, and I'm currently a junior here at Piedmont, and I am a part of the new program of the Communication Sciences and Disorders major. So my project is going to be over the internet resources that are out there for parents who has a child who may have a cleft lip and or palate. And the purpose of this is to examine the content quality of online information. And I specifically looked at YouTube videos over speech, hearing, and feeding. And the goal of this was to eventually create a resource for parents to be able to use during counseling or therapy with a professional so they can provide the best care possible for their child. So in case you don't know what a cleft lip and palate is, it is a birth defect where the tissue doesn't join together in the cleft in the lip or the palate, and they can both occur at the same time, or they can occur separately. And so this is a problem for speech, hearing, and for feeding because of this hole or the slit in the lip or the palate. And so that affects a lot of different things. And it's important for an SLP, which is a speech language pathologist, to be aware of these because an SLP is a part of one of the many professionals that will be touching this child during their lifetime and helping provide care for this child to still be able to have a somewhat normal life. Because when you find out your child has this cleft lip or palate, a lot of things change because the way you feed and the tools necessary to be able to feed are very different than that of a normal, because they can't create a sucking motion, which can cause a lot of problems. And their speech is also affected because we obviously need to be able to communicate with our lips and our tongue for those articulation movements in everyday language. So what we are finding in the healthcare world is that more parents are doing their own research on the internet and they're not consulting their healthcare providers. And this is an issue because, as we all know, that there's a lot of misinformation on the internet, and it's important for healthcare professionals to be able to be knowledgeable of the misinformation on the internet so that they can combat what their patients might be learning and provide them the best care and help them. And parents also are seeking out support groups online, which can be good because they know they're not the only ones going through this experience in their life, but also on the support groups that they might be finding negative connotations of this birth defect for their child. And that can be very hard for the parent to come to understanding with, and it can be not motivating for them to continue to be positive about this experience and be able to help their child. So I specifically looked at YouTube videos because YouTube is a good method for parents to be able to see how speech, hearing, and feeding can occur for a child with this cleft lip or palate. And there has been other research done in the with the importance to an SLP over different areas that an SLP will be covering, but there hasn't been a lot over resources on YouTube for parents or families. And so there's the information that's often out there is low of quality and content, and is sometimes very negative and actually is not proven useful for the parents in this situation. So for this, I started off with using the search term cleft lip and palate plus speech, language, hearing, and feeding. And of those, as you can see, there are only 652 videos that could be possible, but of those, only 165 met the initial criteria for inclusion, which means that from those 652, only 165 had speech, language, hearing, or feeding in the YouTube title or in the description. And so from there on, we minimized that data set by also looking at who the source of the video was to see if they were good, and we excluded any lectures, continuing education opportunities, and news networks. And so that helped bring our down, because we saw a lot of lectures being posted online that pertain to this video, like this topic, but not an everyday individual can have the knowledge for being able to understand what all those videos were talking about. So they weren't proven useful for parents. And of those videos, you can see there's a big gap in the amount of videos that's out there for speech and hearing compared to that of feeding. And we didn't find any videos with language, which is also very alarming, because it's one of the bigger issues with a cleft lip and palate as well. So to do this research, we looked at every single YouTube video, how many views it had, thumbs up, thumbs down, and the video length. And then from there, we used a assessment tool called the PMAT, which is just about 12 sections in the understandability, where you score the video from disagree or agree of 1 to 0. It's very cut and dry to assess the understandability and actionability for a parent or family to be able to use. And for the video to have met the criteria and be included in the final resource that can be created for parents, it has to score at least a 70% in both of those categories of understandability and reliability. And so this is just a little bit of the overall data that we found. Each video ranged from either 36 seconds or 16 minutes and 11 seconds. And the reviews were from 41 to 103,000. And some had no thumbs up, or some had up to 588 thumbs up, and none of the videos had any thumbs down. So after we conducted the PMAT assessment over all the videos, we found that only 11 plus of those initial 37 feeding videos met the criteria to be able to be included in understandability and actionability, whereas only two out of the 3 videos for speech met the understandability and actionability, and none of the hearing videos met any of the criteria. So in conclusion, there are very few video resources out there for parents whose child might have a cleft lip or palate, and there's even fewer for when they're specifically looking for resources with speech and hearing compared to feeding. And what we found was also in the feeding category, a lot of the videos would be more useful as a supplemental resource for the parents rather than standing alone, just to make sure that the parents are understanding exactly what is being talked about in the video, so that way when they are helping their child with the feeding process and everything, it will all go smoothly instead of a bunch of guesswork per se. And also, as I stated before, that there were no language videos out there, which is especially important to an SLP because we deal with speech and language. And if we cannot provide the adequate care and help the parents find videos and resources for that, then it will make our job a lot harder, and the parents might not have a positive connotation of this defect for their child as well. And those are some of my resources. So does anybody have any questions? Yes.
So how would this, like for Jameson, I guess, individuals would speak different messages, like with the same process be adequate for them?
Yeah, we looked specifically at videos that primarily spoke English, because there are a lot of ones where we found resources from like India and Kenya. But as far as like still creating the same articulation with your mouth and everything, every obviously language has their own way of speaking and communicating. So for the speech and hearing would be a little bit different, but for the feeding, like the swallowing and sucking motion for the lips and the palate, it's all pretty much the same. It's just finding out what Nick and trick will work best for your child in the situation, because there's a gazillion methods that could be used. I hope that answers your question. Okay. Are there any others? No. Okay.